Welcome back, everyone. Our sponsors at Inovia Vein Centers just opened a brand new office in Vancouver, Washington. They specialize in treating patients with vein disease. And the other day, one of their doctors stopped by to tell me all about the work that they do. Check it out. Dr. Lauren, thank you so much for being here.
Thank you for having me.
So you got to tell me more about Inovia Veins, because you guys have a new location open, right?
Yep, in Vancouver. So we're a surgical specialty group. We specialize in venous diseases, and so that includes varicose veins, venous ulcers, also blood clots, and diagnostics as well. So we have 4 locations in Portland, one in Bend, that's our founding location, and then the new one is in Vancouver.
Wow. Okay, so I've heard of varicose veins. Is that something that we get as we age, or should we be looking at something like that now in our 20s, 30s?
So the most common cause of varicose veins are just genetic and wear and tear due to gravity on Earth. So for most people, it's going to run in families and it'll get worse as we get older. And it's a wide spectrum of how bad that can be.
Yeah. What are some of the most common conditions that you see people coming in the door with?
Yeah. So yeah, like I mentioned, it's a spectrum. So it could be anywhere from cosmetic, and this is kind of the interesting part of my job because it is a wide spectrum. So just don't like the look of them, to venous skin diseases or causing heaviness and leg swelling because there's so much pooling of blood, and then ultimately like skin breakdown and ulcers. So even though it's the same pathology, we do see a wide spectrum of how much it bothers someone.
Yeah. What does the treatment look like? Is there a patch that we just put on when we come in?
Almost that good. So 20, 30 years ago, the surgical treatments were very painful, and that was stripping. But nowadays we do venous ablations and other minimally invasive office-based treatments. So it's more like a dental appointment in that there's little injections, but very low downtime, and you're in and out of the office very quickly.
Oh, that's perfect. So how do people know if they're a good candidate for it? Because I know, and just like what they might come in for, the spectrum is very wide for how, you know, the veins might look, right?
Yeah. So that's very individualized in my opinion. Most people could be good candidates if they want it, and we just describe the risks and benefits, and the risks are quite low, but nothing is no risk.
Right.
And so we kind of individualize the risk benefits for you as an individual and then make a decision together. But in general, the older folks, if they have really serious heart problems or active cancer or, for example, a pregnancy, those are the people I wouldn't recommend treating right away with surgical procedures, but there's still things we can do to advise them regarding wearing compression garments, and so we can still give advice about how to feel better even if it's not a good time in your life for a procedure.
I love that it's specialized like that. You are really paying attention to each person that walks through the door, because it's not a one size fits all.
Absolutely, yeah.
I love that. Is insurance covering kind of some of these, if not all of our treatment options?
Yeah, most insurances cover if you have swelling that is not responding well to wearing compression garments, or if you have aching pains, skin problems. But for the cosmetic, that would be cash pay. But yeah, insurance often does cover if you're suffering.
Yeah. What would you say to someone who's kind of like on the rocks about, do I go in? I'm not sure if I really want to, or if it might hurt. I know.
Yeah, I would just start with a consultation, because we can give a lot, like I said, a lot of education and about, okay, maybe now's not the right time, but what should you look for? And that would make you realize that it is a good time to get that, and that would help you. And then we also do offer like laughing gas and some sedation. So if people are nervous about needles, there's ways to get around that too.
Oh, I love that. Anytime I can get laughing gas instead of a needle, sign me up.
I mean, you might get both, but it makes it a lot more tolerable.
Yes, it does.
My office staff is really friendly. We all try to make it a really comfortable environment so people aren't as nervous and just feel like they're being really taken care of well.
I love that. And you have multiple locations for us to choose from. This is perfect. Thank you so much for being here. I love that we can give this information to all the people out there.
You're welcome. Yeah, I hope that helps a lot of people.
Huge thank you to our sponsors at Inovia Vein Centers. And if you're still not sure if you would be a good candidate, then just pick up the phone and give them a call at 1-800-VEIN-DOC.